Dr. Sai Lakshmi went to St. Francis College for Women 2 years before gaining entry to Gandhi Medical College. She was there for 5 years and she left qualified as both a physician and a surgeon. On the 20th of January 2001, an earthquake hit Gujarat, killing 20,000, injuring many more, and making 400,000 homeless. She stepped forward to volunteer, and then, despite it clashing with her exams, 7 years later, she volunteered again when the Bihar flood made millions homeless, when a river chain with force flooded many inhabited areas. She has been working as a junior consultant when she had tried to work out how to support the 60 orphanages she had teamed up, each one with a colleague pediatrician. Her colleagues were keen to help, but in times, the system was not really working. The establishment of the EKAM Foundation in 2009 was her attempt to refocus on the problem of supplying care. She was awarded one of the first 8 Nadi Shakti Awards for her leadership and achievement in 2015. The award was made on International Women's Day from then Indian President Pranab Mukherjee. Now let's welcome Dr. Sai to deliver her address.
Thank you, Samir, and thank you all. And it's a great occasion for EKAM. A dream come true, I would say. And Samir, being a young kid, it's amazing with your efforts. It's happening. So EKAM's journey. This is the 11th year, and started with a vision to work for the health and well-being of children, extended on to working towards the well-being of mothers and communities. Has been wonderful, and it reiterated one thing that for any pure intention, nature responds with lots of love and abundance, and this is what I am actually seeing now. Started with a single individual, and now there is the global platforms which got set up thanks to Nilima, who set up EKAM USA, and it's like really growing big. And the UK teams, Ajay, Preetham, Rajni, and Vaikund, who started, and Ramak from Canada. It's amazing. In 10 years, it grew up beautifully. Samir, you could just start the presentation so that. So over a period of 10 years, realized that initially it started off as a charity mode in 2009, admitting the children as and when the children need help, starting with the private hospitals and then extended it into the government hospitals, and then realized that just working for the children and newborns, it would not bring down the neonatal mortality rate, and realized that we need to work for mothers as well. And then while working with the mothers, we realized that we need to work with the communities as such, and health as defined by WHO as physical, mental, emotional, psychological, and spiritual well-being is necessary rather than physical health, which doesn't actually bring in the well-being aspect. So that's how EKAM very strongly believes in bringing in the gross happiness of an individual, family, and community, which would ultimately result in bringing in the well-being of children, mothers, and thereby bring down the neonatal, infant, and maternal mortality rates. So that's how we ended up started working with the gross national happiness as one of the indicators. And if you see, United Nations very strongly propagates gross happiness, and the 4 pillars being sustainable development, cultural values, natural environment, and good governance. Next slide, please. So good governance plays a very important role in the journey of EKAM. We too realize that until and unless the governance is there, we cannot achieve what we want to achieve in bringing down the mortality rates. Samir, next slide, please. So as a part of the Sustainable Development Goals, the UN says good health and well-being. Next slide, please. So the well-being as measured globally is being measured as Happy Planet Index. So the Happy Planet Index, Samir, next slide, has 4 components in it. The 4 elements, again, next slide, Samir. So if you see the 4 components, well-being plays a very important role, life expectancy, inequality of outcomes, which is again brings in the governance aspect, and ecological footprint, where the environment plays a very important role. So it is HPI is well-being into life expectancy, into inequality of outcomes by the ecological footprint. And if you see, India is actually ranks 50th in position. And so we really need to are working all our indicators towards the Happy Planet Index, and we are calling it as Sustainable Wellbeing Initiative, which is in a big way funded by EKAM USA. Samir, next slide. So the Happy Planet Index, if you see, the countries which are actually materialistically rich are not ranking first, but the countries like Bhutan, which have these indicators, are actually standing ahead in the well-being. And we have taken the SDG indicators as the primary importance. And if you see the global maternal mortality rate, the target is to reach 70 per thousand live births, and the preventable deaths of newborns and children. So we are aiming to achieve this in different states in India. And so to start with, we have started in Tamil Nadu. Yeah, Samir, next slide, please. So the SWBI model has all the components which has the SDG goals, and the process and with which we have come across is to build a EKAM soul force, which has all the 5 pillars, where we call as the knowledge aspect. Then there is a resource mobilization, incentivization and sustainability aspect, and there is a good governance, as well as there is a good administration which takes care of it. And so if all with these 5 pillars, we are aiming at building an EKAM soul force, which in turn builds an interbeing soul force, which is without EKAM. That is one of the core value of EKAM, which is the self-obsolescence, where we talk about build, own, operate, and transfer model. That is actually empowering a system rather than actually creating a dependency. So if you see, we start with an EKAM soul force, and the EKAM soul force in turn builds this interbeing soul force at district, block, and panchayat village level to make the mother, youth, and individual as a change maker. Until and unless the mother becomes the change maker and governs herself, or an individual govern themselves, it cannot become sustainable. So that's the goal of EKAM, to shift from EKAM soul force to an interbeing soul force. And next slide, please. So as you see, this is aimed to bring in CCPP committees, which is like community, civil society organizations, public and private sector, all play a very important role in taking the ownership. And once this is achieved by transferring EKAM soul force to an interbeing soul force, it gets handed over to the government, and the government operates themselves. So that's how it becomes a sustainable model. At the end of it, we do not want to depend continuously on donors, but it should become a sustainable model. So we have the vision and 4 core values, 5 pillars and 4 principles. Samir, can you go on to the next slide? Yeah, so the 5 pillars, as we have seen, building this interbeing soul force, which is without EKAM, by actually integrating it into the government system so that it becomes sustainable. So we have these other 4 pillars who actually support to make it happen. And the 4 values, you see, self-obsolescence is something where without EKAM, we need to come to a boot model that is build, own, operate, and transfer. And the 4 principles is bringing in the confluence, that is building the community, civil society, organizations who are proactive. They sort of actually form these committees at various levels, and they sort of actually converge with the committees which are existing with the government system, and which ultimately builds the interbeing soul force, and they take up the collective responsibility, and for which there is a sustained motivation which is needed, and we are working on it by bringing in intrinsic motivation process and integrating it with an incentivization process. So this is the complete model of EKAM to achieve the well-being of children, mothers, and community, and make it a sustainable model. So this is the vision, and this is now started in partnership with UNICEF, and multiple organizations have joined hands now, and we are going to show it in Tamil Nadu as a model, which would become a replicable model across other states. And so this has been an exciting learning, and it all got evolved by beautiful learning process which happened. And there is an amazing I mean, hands joined across, and you see that there's a global partners joining hands, and EKAM USA is playing a very big role in making us realize our vision currently, and I'm really excited sharing the model and vision, and thank you so much. Thank you.